Another rehabilitation concept to consider is the foot core system and intrinsic foot muscle function. Optimal function of the extrinsic foot muscles is reliant on function of the passive, active, and neural subsystems of the foot core. Together, the system allows an individual to adapt to the demands of a changing task or environment during functional activities. While evidence exists regarding interventions focused on the passive or neural subsystems, targeting the intrinsic foot muscles has been suggested to be a crucial component of foot control and provides support up the kinetic chain. Two concepts that are integral to core stability are motor capacity, including muscle strength and endurance, and motor control, including the coordination of the local stabilizer and global mover muscles to provide efficient movement. The abdominal draw-in maneuver is an exercise that is traditionally used to train the lumbopelvic core. It is hypothesized that the short foot maneuver is a similar exercise for the foot core. When initiating foot core training, an essential element that must be started first is the awareness of the target position for foot control. The target position for foot core training is a subtalar neutral foot position. This is similar to lumbopelvic core stability training in that we train a patient to find pelvic neutral before helping them learn to activate the muscles that maintain that position during exercises. The intrinsic foot muscles play a critical role in foot function. Their role includes the coordination, capacity, and sensory components. In addition, their dysfunction may contribute to the development of lower extremity overuse injuries. We've seen that there is a greater activation of these muscles with increasing demands. Some examples include sitting to standing, bipedal to unipedal stance, and slower gait to faster gait. To assess the intrinsic foot muscles, clinicians can use the intrinsic foot muscle test. Individuals are asked to maintain arch steadiness during single limb stance without overactivity of the extrinsic muscles. The test is then subjectively graded by the clinician as satisfactory, fair, or poor. Figure 5A depicts incorrect patterning, whereas Figure 5B depicts correct patterning. To train the foot core, clinicians can utilize a variety of exercises. Some of these include the short foot exercise, the toe spread out exercise, isolated greater toe extension, and isolated lesser toe extension. During the short foot exercise, individuals are asked to slide their first metatarsal head toward their heel while keeping their toes straight. There is an emphasis on plantar intrinsic muscle activity and no extrinsic muscle activity, for example, flexion or hyperextension, is allowed. During the toe spread out exercise, the individual is asked to raise all 5 toes, spread their toes out, and then bring the first and 5th toes back to the ground. During the isolated greater toe extension exercise, individuals are asked to raise their first toe while keeping the lesser 4 toes on the ground. Extrinsic muscle activity of the lesser four toes should be limited. During the isolated lesser toe extension exercise, individuals are asked to raise their lesser four toes while keeping their first toe on the ground. Extrinsic muscle activity of the first toe should be limited. An isolation to integration paradigm can be used as a framework for training the intrinsic foot muscles. As patients progress, it is important to evaluate whether they are responding to the isolation training or foot core exercises. If they do respond, patients can be progressed to more advanced isolation and integration activities, which help prepare the patients for return to sport or participation. If the patient does not respond, the clinician should consider other contributors to foot core stability, such as the passive subsystem and the extrinsic foot muscles, and progress as appropriate. It is important to recognize that the foot core system represents the interaction of multiple systems. Training the intrinsic foot muscles provides a means by which their interaction can be enhanced.